Welcome to the Hartman in-service module and application guide for Hydroclean Plus. Hydroclean Plus is an all-in-one dressing that will lift off sloughy tissue from the wound bed, remove bacteria and debris from the wound and up into the dressing, kill the bacteria once absorbed into the dressing, and promote the growth of new granulation tissue. The Hydroresponsive dressing has a unique rinsing-absorbing action that will effectively clean and prepare the wound bed for healing. The low-adherent wound contact layer is coated in silicone strips to prevent adherence of the dressing to the wound. The hydroresponsive core of the dressing contains superabsorbent polymers to absorb the exudate, debris and bacteria while also donating Ringer's solution to the wound bed to rinse and soften the dead tissue. Also within the dressing core is an antiseptic called polyhexanide, which will kill the bacteria that has been absorbed up into the dressing. Finally, the top breathable layer prevents strike-through and ensures correct application. How does the rinsing absorbing action work? While on the wound bed, the Ringer's solution is donated to the wound to soften the dead tissue, allowing it to be absorbed up into the dressing. With it comes bacteria and debris that harbours bacteria. Once within the superabsorbent polymers, the bacteria is killed and the polymers hold on to the exudate, dead tissue and debris, preventing them from being released back into the wound. This action restores the balance on the wound bed, allowing for the growth of new granulation tissue. How to apply Hydroclean Plus. Select the size based on the size of the wound. It can be slightly larger than the wound, or you may want to just sit it over the surface where the dead tissue lies. If the dressing is slightly larger than the wound, cover the peri-wound skin with a barrier cream or protective wipe. Always put the side with the silicone strips onto the wound bed and the side with the writing away from the wound. Never cut the dressing. Secure the dressing with some tape. Depending on the level of exudate, if it's low, then cover the dressing with a film to secure it. If the exudate level is higher, then apply an absorbent dressing over the top, such as Hydroclean Plus, to help manage the exudate. Secure with tape or a bandage, such as Haft. The dressing can stay in place for up to 3 days, depending, of course, on the exudate level. Are you looking after anyone with a wound that would be suitable for Hydroclean Plus? A sloughy wound or a wound that's just stuck and is not healing. Always ensure the blood supply to the area has been thoroughly assessed before debridement of the wound takes place. Hydroclean Plus comes in a variety of sizes, as well as a cavity dressing for deeper wounds. The cavity dressing doesn't have a backing layer, so it can donate fluid from both sides of the dressing. In summary, Hydroclean Plus can debride, clean and absorb exudate to restore the balance on the wound bed. It works continuously over the time it's on the wound. It reduces pain on the wound bed and promotes the growth of granulation tissue. Thank you.
Chronic and hard-to-heal wounds like venous leg ulcers can only be successfully cured if the underlying cause is eliminated or at least sufficiently kept under control. In addition, adequate moist topical wound treatment is very important. The first step, Hydroclean Plus provides active wound cleansing. Large molecules deriving from fibrin slough and/or necrotic tissues move together with the exudate towards the area of lower concentration, in other words, into the wound pad. Within the wound pad, these molecules are tightly bound and thus removed from the solution. At the same time, Clean Ringer's solution is released and supplied to the wound. As long as the large molecules are bound to the dressing core, the wound pad will continue to absorb exudate and Ringer's solution will continue to be supplied to the wound. This active rinsing and absorption process continues as long as there are sufficient binding sites for the large molecules available.